Assalamu alaikum. Welcome back to my channel. Today I have a congenital abnormality case. Have you ever encountered a rare cardiac case where subaortic stenosis and cleft mitral valve exist together? No, I have in this case. This is usual combination can pose a serious hemodynamic threats. Today, let's break down this complex conditions with the echocardiography examples and clinical insights. Question number one is what is subaortic stenosis? The subaortic stenosis is a form of left ventricular outflow tract obstruction typically caused by a fibrous or membranous ridge just beneath the aortic wall, as you can see in this alveolar tract, white membranous ridge. The ridge membrane narrows the outflow tract, forcing the left ventricular uh, to pump harder, leading to left ventricular hypertrophy and pressure overload. Findings of the subaortic stenosis usually in 2D views. We use parasternal long axis. Yes, this is the parasternal long axis view and the apical 5 chamber. This is the parasternal long axis view with color Doppler. So that see the turbulence here in the near the ridge, and also you can see the aortic insufficiency, aortic regression. This is the 5 chamber views. The membrane also see here, and the aortic regurgitations beneath in the aortic valve near. So this is the 2D views of the parasternal long axis and the apical 5 chamber, in which we see the membrane in the alveoli, and which can lead to subaortic stenosis. Okay, the gradients and the severity is the mild pressure gradient is greater than 30 is significant. More than 50 is moderately stenosis, and greater than 70 is severely stenosis. In this case, we have a 60 millimeter of mercury pressure gradient. So this is moderate type of subaortic stenosis. Also check for aortic regurgitation. In this case, we also see the aortic regurgitation, the red flow from the aortic well, and here also in the apical 5 chamber, the red flow towards the probe is from the aortic well is aortic regurgitations. Associated condition with subaortic stenosis. Subaortic stenosis may be isolated but commonly associated within the bicuspid aortic valve, but in this case they have tricuspid trileaflets, also with ventricle septal defects and Sean complex. If you know about the Sean complex, so comment below. If not, or you wanted to know about Sean complex, then also comment. I will make another video for this. And the mitral also associated with mitral anomalies, like the cleft mitral valve, which we have discussed in this case. As I told earlier in this video, they have two lesions: the subaortic stenosis and the cleft mitral valve. So we discuss the subaortic stenosis, and we see how it is visualized. Now we discuss the cleft mitral valve. A cleft mitral valve is a congenitally defect where the anterior leaflet has a slater-like division or gap, preventing normal leaflet coaptation. This is the four-chamber view. In the mid-anterior scallop, the blood come to the LA, or regurgitation in the mid portion of the anterior leaflet. So this is called cleft mitral valve. In this case, the mitral regurgitation often seen as eccentric posterior directed jet, as we see in this case. An cleft mitral appear is a linear gap or indentations. This is the short axis view. The anterior leaflet has a gap in the center. In the parasternal long axis, we also see the anterior leaflet gap and the regurgitant shunts. Types and association of the cleft mitral valve is it may be isolated cleft mitral valve with otherwise normal structure of the heart as and the second type is cleft as a part of interventricular septal defect. It may be associated with atrioventricular septal defect, ostium primum ASD, left-sided obstruction lesions, or subaortic stenosis as in our current case. Echo features of cleft mitral valve apical four chambers, as we see in this four chamber view, and parasternal line axis shows the cleft in the anterior leaflet and short axis view also very useful for the cleft mitral valve. Color Doppler may have eccentric MR jet open posteriorly directed. Remember, subvalvular apparatus is preserved, no commissure effusion, which is helped from the rheumatic MR. Now you can watch this full video as a subaortic ridge you can see and the cleft mitral valve also see watch the full videos and what is the complication of the two lesions combines the danger of the double load when the subaortic stenosis and the cleft mitral valve exist together the left ventricle faces double burden pressure overload from the obstruction of the subaortic and volume overload from the regurgitation of the cleft mitral valve. The combination rapidly worsens LV remodeling, reduces cardiac output, and increasing the need of timely surgical interventions. To summarize, the subaortic stenosis fixed alveoli obstruction, commonly membranous or fibromuscular, and cleft mitral valve congenitally leaflet gap causing eccentric MR. Early detections via echo can significantly impact patient outcomes, especially when these lesions coexist. If you enjoy the rare and complex echocardiography cases, then subscribe my channel, hit the like button, and leave a comment. Thank you for watching, and we'll see you in the next cardiac challenges. Thank you.